Dr. Saw, I think we should start off with what exactly is stem cell therapy.
Yeah, stem cell therapy is, if you look at stem cell therapy as a whole, this is something that's been around for quite a while. It started with the blood specialist many years ago, the hematologist, using peripheral blood stem cells to treat for bone marrow transplant. But recently, there have been lots of work on embryonic stem cells, which is not the preferred cells that we're using. I can only talk about stem cells from orthopedics point of view because we use a lot of that for the musculoskeletal system. And for what we do, we use peripheral blood stem cells, which is actually stem cells that we harvest from patients' own blood system. Okay, so it's what we call autologous cells, that which is patient's own cells. We're not using allogenic cells, which is cells that is harvested from other patients or obtained from other sources. Now, from orthopedic point of view, it is not just injecting stem cells into a part and expect the fracture to heal or expect to cure a panacea of diseases. It doesn't work that way. So, for example, a lot of our work involved treating cartilage damage in the knee joint. So if you look at the cartilage in the knee joint provides a smooth gliding surface in the knee. And when this smooth gliding surface breaks down, the underlying bone is exposed. So when that's exposed, patient will have pain. But a lot of technology outside there, they punch a few holes called microfracture and allow the cartilage to heal. But a lot of times they don't heal properly. Okay, and then people think that you can just inject either stem cells or PRP or whatever in there, allows it to heal. But again, it doesn't work so well because there's a lot of surgical technique that you need to do before you inject your stem cells. So a lot of people think outside. Sometimes I see patients coming to me. Unfortunately, they paid quite a lot of money for injection of stem cells into the joint, but that doesn't end up having the desired results that they want. So there's a whole protocol when you want to apply stem cells for application, for example, in the musculoskeletal system that we're doing. There's also PRP. You may have heard of PRP, which is called plasma-rich. And PRP is something that is harvested from the blood just by taking a bit, 20 mils of your blood, spin it down and inject into your joint. Some people use it for cosmetic reasons and things like that. But from the orthopedics point of view, it's been shown to have pain relieving effects, but they do not really reverse the pathology. They don't reverse the tendinitis or do not grow cartilage. So this is the stem cell we're talking about that we're using in our office.
Specifically in orthopedics?
For us, it's specific orthopedics, but there are other stem cell technology out there. People use it for bone marrow transplant. The other surgeons may use it for different applications, but I'm not so versed about what they're doing, and I don't have much evidence based on what they're doing. But whatever we're doing, we try to be as evidence-based as we can.
Right. So you said that stem cell therapy sort of started up quite a few years ago. What kind of timeline are we looking at here?
Well, you see, 20, 30 years ago, the bone specialists, the hematologists, the blood specialists have been treating diseases like leukemia with harvesting stem cell from the blood. And that can be either from a relative, which is called allogenic transfusion, or from your own, which is your own cells. And that normally they use chemotherapy to kill off the existing cancerous cells and then transplanting the stem cells to rebuild the bone marrow to produce normal blood vessels and blood cells again to enable the individual to survive the cancer.
Right, so 20 to 30 years ago was when it first started being used.
It's been around for a while, yes.
Yeah, okay.
And our application started about 15 years ago. Because what happens as a practicing orthopedic surgeons, I see a lot of problems day to day. So, for example, athletes will come to my clinic and we do keyhole surgery for them, and we see a area of cartilage defects, and we don't have a good solution for them. So the athletes will end the career because we can't fix the problem. So about 15 years ago, we thought, is there a better way of doing this? Because the current technology cannot address the problems that we're facing. So we start doing some animal work and publish our animal results. And then we started applying this technology in humans, starting from back in 2007, we did our first case.
Okay.
And we found the results were very satisfactory. And we published then our results in our international journal to show that this technology works using stem cell to rebuild cartilage. So most of our work is actually from rebuilding knee cartilage. But as time progresses, with the information and knowledge that we have in building cartilage with stem cells, we've applied this technology to the various aspects of the musculoskeletal system.
So within, for example, we're talking about orthopedic surgery here right now, because that's your specialty. When would stem cell therapy be prescribed to someone? So we know knee cartilage problems. What other areas work really well with this kind of therapy?
Yeah, the other part that works very well is, for example, tendinitis. So a lot of athletes have got Achilles tendinitis. You got Achilles tendon, and sometimes you get Achilles tendon rupture. But before that, a lot of individuals will have pain in the Achilles tendon itself, and they have pain running, they even pain walking and climbing stairs. So that's Achilles tendon. But the other problems is patellar tendon, which is your kneecap. The tendon can be inflamed as well. This is called the jumper's knee. So individuals that does a lot of volleyball, basketball can have this jumper's knee. Basically, they're all overuse injuries of the patellar tendon. And common things that we see are tennis elbow that individuals have, a golfer's elbow.
Yep.
And a lot of these individuals ended up having steroid injection. That is okay just to mask the pain, but it doesn't reverse the problem, doesn't regenerate or doesn't rebuild and reverse the underlying problem. So this is where I think stem cells comes in. But we don't use stem cells as the first treatment. Normally we will start applying some anti-inflammatory medication, first physiotherapy. So that is the main treatment plan for patients. Unless these things don't improve, then we will then look at whether stem cell technology can be applied to these individuals.
Right. What are some of the common myths and misconceptions around stem cell therapy?
Well, the myth is that people think that stem cells can cure everything,
Right.
and,
Yes.
and a misconception, a lot of times patients come to me and think that we can just inject stem cells into the joint and then it will reverse. So a 60-year-old knee can be reverted to a 20-year-old knee just by injecting stem cells.
You mean it can't?
I'll
cancel my appointment with you then, doc.
We can't do that, unfortunately. We can make it better, but we can't reverse that pathology. I mean, there's an aging process that we have to respect, unfortunately.
Right. Well, also, you don't want to fix a knee, because if the hips are bad and you start jumping in the knees will be fine, but your legs might pop out your hips.
You can fix everything.
Yeah. Okay. So it can be fixed. Everything can be fixed is one myth. What are some other sort of myths that make people concerned or worried, or perhaps they're more misconceptions?
Well, people are worried about stem cells in such a way that if you look at embryonic stem cells, embryonic stem cells are not something that we use because like an embryo, the embryonic stem cells can grow into many types of tissues. So for example, if you use embryonic stem cells into the spine, it may grow different tissues that's not desired. It can be cancerous cells or whatever. So that's not what we want to use. So we've been most of the stem cells that's in application currently are basically adult stem cells. And for us, the gold standard is using your own stem cells, because these are your own cells.
Right.
You harvest it from your body, use it, and it's a lot safer. And as I said, a lot of this has to be evidence-based. So currently, we have just finished a US FDA phase 2B clinical trial treating massive cartilage defects. And that showed the safety and efficacy way of using patients' own blood stem cells to regenerate cartilage in the knee joint. And I think, stem cell therapy and everything has to be evidence-based, and you can't say, oh, this is good, we just inject it, you'll be fine. But it's not going to work, and it can be dangerous as well.
This is a very random question, and I'm sure it's completely irrelevant. However, is the idea of stem cell therapy sort of the idea that was running around with eating your own placenta?
Yeah,
I mean, way back when there was this sort of thing about the placenta and sort of then the cord and the baby and that was that part of the whole stem cell. I only asked because, it was asked of me if I wanted to preserve that when I was pregnant with my son.
Sure. I mean, I think the cord blood has got application for that. I mean, people are using cord blood to treat different diseases, so that there is an application for that. But I think the placenta, when you cook it or fry it or whatever, the cells will not be viable anymore.
So unless you're going to have it raw like oysters, it isn't going to work.
But you see, the digestive system will be, when you ingest this into your stomach, there's hydrochloric acid in your stomach will be not a conducive environment for your
It'll kill everything that's good.
Basically,
okay,
yeah.
So let's move on. That was just a random question. Keith, you can edit that out if you think it's ridiculous. Okay.
But let me just say something. So if it works so well, everybody will be using placenta and eating that, and there'll be lots of individuals that is 100, 200, 300 years old or more than that. So as I said, evidence-based has to be evidence-based.
Okay, talking about evidence-based, and you were talking about sort of the idea of stem cell therapy is not your first thing, but the second or third sort of direction you try out with stuff. Can you tell us a bit about working with Muhammad Danial, the MotoGP rider, and your success story there?
Yeah, sure. This is the application that we use stem cells to rebuild his bone. So let me just, can you see that?
Yeah, this was in November 2018 in Sepang.
That's right.
So this is a video you're showing us, Dr. Saw.
Yes, I'm just going to share this video and the subsequent application of stem cells that we use to rebuild his bone. So let me just tell you the story that happened in November 2018 at the Sepang International Circuit.
Okay.
And this is about Muhammad Danial. At that time, he was 16-year-old, a MotoGP rider. He had a collision just before the checkered flag, and as he drifted across the racetrack.
Ouch. What we're seeing here, for those who are listening, is a video of the race and actually Muhammad Danial's fall off his bike and another rider actually riding at full pelt across his leg, which looked rather wrong bending.
Yeah, it was a horrendous injury. So initially, he was airlifted to General Hospital in Kuala Lumpur, and he had this open fracture. That means that the bone is actually exposed. Okay, and don't forget, this injury occurred at approximately 280 kilometers per hour.
Yeah.
So the middle third of his shin bone was shattered into multiple pieces.
Yeah, it just looks like broken shards of pasta.
Yeah.
So emergency surgery was performed in GHKL. They clean up the wound because don't forget it's a contaminated wound. And then all these bone fragments that was exposed had to be removed because they are not viable tissues anymore. And so it ended up having a large segment of missing bone. And the traditional way of initial treatment is actually applying an external fixator just to hold the limb together because, without a bone structure, the lower limb will be dangling.
So you're talking about sort of the pins and the bracket that you can see outside of accident injury.
That's right. That holds it together so that we can transport the limb. Okay. And then he was transferred to our care 48 hours later. And we had to do some skin grafting to provide soft tissue coverage. And then our challenge will be, how do we rebuild this 13 centimeters of bone? And
13 centimeters. So like this wasn't an option of having like a titanium leg or anything in there, bone in there.
No, see, the problem is that, a lot of people think that, years ago we got this bionic man and bionic
Right.
woman story.
Yeah.
But you see, the problem in real life is that if you have anything metal or plastic or cement or titanium or whatever, they don't last forever. You
Oh, not even
know,
titanium.
no, they don't last forever. The joint don't last forever because you still have the integration between the bone and the metal. And
Right.
that is where you have the weak point. So if you can, you always try to rebuild, using patient's own cells. Because when you rebuild the bone using patient's own cells or stem cells or whatever, is a live tissue that undergoes remodeling all the time. So you may have a little stress on the area, the bone heals on its own.
Right.
But in large lesions like this, it's impossible for nature to heal itself. And so our role is actually to assist nature to see how we can use nature to rebuild this missing bone.
So how do you fix 13 centimeters of missing bone, though?
Yeah. So we decided to use technology that's pioneered in Russia initially by Professor Elizarov. And this is using a circular frame. So when you have a missing bone, there's a missing defect of bone, what we do is that we divide a normal section of bone, and then we transport this section of bone towards the missing end. And this started the bone healing process.
Okay, so
Wow.
I just have to explain to people who are just listening here right now. It's like imagine having a circular frame around you, around your calf, right? For example, from your knee down to your ankle, and there's rivets. So it's like attached at the top and attached at the bottom, and literally it is like there's a middle bit that moves up and down. Well, in this case, it starts off at the bottom part of where the foot ends, the foot bone ends into the sort of calfy area, and as the bone grows, am I correct, doctor? The
Yep.
framework attaching that bone is moved up, so you're almost like dragging it, leaving a tail of bone to regrow behind it.
Yes.
Gosh, that's just a bit freaky, but brilliantly genius.
How often do you move that thing upwards?
So we transport the bone at a pace of about 1 millimeter per day.
Per day.
So
Per
was
day.
it like an open like wound, like a zipper that his was in his leg that you could actually move this?
No, the frame allows you to move that segment of bone slowly towards the missing end, and there are screws on the bottom that you tighten up so that it allows the frame to move towards the missing end.
But all this is happening within his.
It's a daily thing, yeah. So
But
it's
But
a daily
obviously
thing.
he's still got his meat, his muscles, and everything there.
But I mean, what like that's happening what inside the leg?
Yes, that's what's happening inside the leg, and the frame is outside the leg.
Okay.
JD right now is
I can feel the pain
extremely
just watching, yeah.
uncomfortable that I think his belly is not feeling well.
No,
Anyway, doctor, carry on. Sorry.
Now, we then use stem cells to inject into the healing bone. So our technology is to transport the bone towards the missing end, and at the same time, while the bone is growing, we inject Daniel's own stem cells to assist in bone healing. So that allows us to rebuild the 13 centimeters of the bone.
So I'm a little bit confused. Are you saying that his bone was regrowing 1 millimeter a day?
Yeah, so what happens is that if you have a fracture, for example, if you have a small fracture, naturally your bone will heal on its own. And either you see the orthopedic surgeon, they put a plaster cast for you, or you see the Chinese
Yeah.
they put a splint for you. The bone will heal, most of the time. But to regrow this missing bone, when we divide the normal segment of bone, what happens is that the healing process starts the day you divided the bone. And as the bone is repairing itself, we then drag out this bone and regenerate this bone. But with the addition of stem cells, we can assist nature to rebuild this bone a lot faster and regenerate the bone to be a better, robust bone.
So it's not just pure scar tissue.
No, it's not scar tissue. This is actually real
Real
bone.
bone.
So if you think about it, this frame is actually from here,
Mm.
and we slowly transport it up there. And when it docks into this area, we have this whole trail of new bone that's formed.
I think that's the right word, docking. It feels like a shuttle is docking with the space station in a way.
It is.
Wow.
Gosh,
It is a docking.
what a brave 16-year-old young man. Anyway, sorry, doctor, carry on. Just for anyone who's listened to this, you must go to the podcast and you must
Watch
have
the
a look
video,
at this. Watch the video. It's very, very interesting. Carry on, doc. Sorry.
Yeah. So as I said, our innovation is actually injecting stem cells to help the bone to regrow. And the frame was removed in about 10 months. Okay. Normally, it will take twice as long to rebuild this 13 centimeters of bone. If you look at this, the missing end of the bone. And so, and rebuilding the bone, and this is a robust bone that allows him to go back to riding, go back to walking.
But so this is just to rebuild the bone to the point
Yes.
where he can actually walk again, because obviously while he's on the bed, he can't bathe, he can't shower, he can't clean up.
Yeah. So he can still have a sponge and all
Right,
that.
okay.
But we can cover this whole area in a plastic bag, allow him to have a shower, so it's not a problem.
Because it looks like a scaffolding around his leg
Yeah.
in a way. Okay, I get it. Oh, wow. That's
Impressive. 13
fascinating.
centimeters of bone. Wow.
Now, so he went back to riding 15 months later. Okay.
As I was saying to
As
doctor,
you would.
as a boy would, yes, and as a mom, I'm sitting here going, if that was my son, I'd just be beside myself. You've already smashed your leg once, mate.
But doc, I mean, between going through this, what was the other option? Was there any other option?
Well, I think when he came to us, there was another problem. Is that he also had quite a severe what we call the MRSA infection, a bacterial infection. Okay,
Right.
and sometimes this bacteria is actually resistant to antibiotics, and if we couldn't get rid of the infected bone, then sometimes you may have to sacrifice that limb. So that was one of the worry that we had all the time for him.
Sorry, when you mean sacrifice the limb, meaning amputation?
Yeah, he may ended up having that because the severity of his limb in orthopedic surgery we classified as a 3B open fracture. 3C is the worst complication where the blood supply is damaged. Okay,
Right.
But he had 3B. Luckily, the blood supply was intact, and we could salvage his limb. And if you lose the blood supply.
And so he had this accident, and then, like 10 months later, he was out of hospital.
He was out of the frame, but
out of the frame.
Yeah, he was in the hospital for about 12 months.
Right, but then 15 months later, you said he was back on the racetrack.
It was back in the racetrack. Yeah,
that's incredible.
Because I was actually at Sepang, and we heard about this horror crash about this kid, because it was a Malaysian ATC rider, and then when we heard about it, we're like, wow, his leg is probably gone, because we hear how bad it is. To see him back on the podium, it's impressive.
So was there sort of, once the leg came out of the frame after 10 months, did like rehab start then? Because I would imagine that with that length of time, you lost all muscle. It's your muscles atrophied. Walking will have to be retrained again. Like, did that?
Yeah. So he had a rehab twice a day while in the hospital. Upper body rehab, abdominal muscles, the leg rehab, and because for bone to heal, you need to stimulate the area as well. And he had nerve damage for the first 10 to 12 months. Then we had to stimulate using a nerve stimulator to stimulate his muscle, so that eventually when the nerve rejoin and regenerates, the muscle will start functioning again. But the other problem that he had was that if you look at our publication in the Malaysian Orthopaedic Journal, because we transported the bone from the distal end to the top end, his foot went into a certain deformity as well, because all the tendons were tight then, and we had to do our foot and ankle surgeon had to do a surgery to release the foot so that he could walk properly.
Right.
So
Goodness gracious me. Well, how's he doing now on his leg? Is it still holding up?
it's still holding up. Just like to share with you that we, together with my co-authors, Dr. Ranjit Singh, our hand surgeon, our Dr. Low, our foot and ankle surgeon, we published this case report in the Malaysian Orthopaedic Journal, and that was published in November last year. And basically, we showed that with the aid of stem cells, we could rebuild 13 centimeters of bone in a short span of 10 months. It's actually a track record. If you look at the literature search, most of the time it'll take twice as long to rebuild this amount of bone.
Why do you think your case was faster?
As I said, it's the potential of stem cells.
Right.
And without stem cells, I'm sure there's no way we could build this bone as quickly as this. And again, I like to emphasize the importance of evidence-based medicine. That's very, very important. And as I said, we've been right from the beginning. 15 years ago, we've done animal work to show that this technology works. We're now embarking on. We just finished a US FDA trial to look at safety and efficacy of this technology. And currently, we've treated almost 1,000 patients now with stem cells in the last 14 years. And we're bringing patients back for X-rays and MRI scans to make sure that the application of stem cells do not have any unforeseen effects, and touch wood, it is pretty good at the moment.
So far, yeah. It'd be wonderful to see how it works on paralysis and those kinds of things which are considered gone cases.
The beauty about the stem cells is that we can actually push the frontier of medicine and a lot of unmet medical needs, especially in orthopedic surgery. We can address these unmet medical needs, and that's great. The previous slide that I showed you, the QR code. If you go into that YouTube, you can see the video of more patients that we treated with stem cells. How we rebuilt the whole ankle joint, which is totally without cartilage, and this is the future of medicine, really.
Well, yeah, we'll be sure to have a look at that and put all those links up for you. But Doctor, so just to question, the general perception is that stem cell therapy is just like not for anyone because the cost is astronomical. What would a case like Mohammed Daniel's cost for the general person?
Well, the stem cell cost itself starts from like the cost of, I'm talking about cost of the stem cells alone, okay?
Right. This is like extraction of them or whatever.
Extraction and storage of the stem cells. That the simplest one would be like 15,000 ringgit that we harvest, and we keep his cells in like 20 vials of cells, okay? In a 4 millimeter vials of cells. And that goes up to 20,000 ringgit, 25, 30,000 ringgit, where we have a maximum cell storage for him. But this is just the stem cells harvesting part of it.
Right.
And so, for example, if we need to regenerate a cartilage in the knee joint, the stem cells may cost about 15,000, but the surgery and the physiotherapy itself may be something like 30, 40,000 ringgit to rebuild the cartilage.
Okay.
Right. So would you foresee that in the very near future, like in the next 5 years, perhaps, that this is something that more people could afford? I mean, you're thinking of people in the sort of the B40 and the M40 group who are most likely to suffer these accidents from motorbike rides and all those kinds of things. So these kind of injuries that are debilitating because they actually stop this person supporting their whole family. Where do you see stem cell therapy in terms of it being available like penicillin is?
That's where all the FDA trials and everything the evidence-based medicine is important, So when you have, for example, if FDA approved this technology, our Malaysian MPRA eventually approved this technology, then insurance company will adopt this technology and will pay for that treatment. So at the moment, the patients will come to our practice. This is out of pocket, The surgery itself will be paid by the insurance company, all the companies involved, but the stem cell part of it, patient have to be out of pocket for. But eventually, once this is proven to be safe and have the efficacy, and the authority approve this technology, it's the same as your vaccine. If this is approved eventually, then it'll be widespread, and insurance company will be able to use this technology and I suppose reimburse for the stem cell portion of the treatment. But if you look at the patients who are involved with bad fractures, sometimes the bone is infected, and the only way to do that is actually to remove the infected section of the bone, and we can use this technology to rebuild the bone again. So the technology is there.
Because you've proven it.
Technology is there and it works, but
and the source is there. I mean, we are our own source, which is kind of a nice thought, rather than sort of there have the ethical, moral questions of where you get the stem cells from.
It's our own.
As I said before, it's actually us doctors assisting nature,
right? In a very Star Trek manner, which leads me to my next question. So, Doctor, if people had an injury or an illness that you felt could be helped with the use of stem cell therapy, and they were afraid or skeptical about this, what would you say to them to convince them to give it a go?
I'll speak from the orthopedics point of view. It's no good me talking about other diseases which I'm not involved in. But for example, in orthopedic surgery, when the patients come to our practice, we have a lot of patients that can speak to, and that's the best part about it. So I have a lot of international patients as well. So I have patients from the US, patient from the UK. And normally what I try to do is that if there's a query coming, for example, from New York, I will say, why don't you get in touch with my patient in New York, or my patient is from Sydney. I say, get in touch with my patient from Sydney, have a chat with them. Or Malaysian patients coming to our clinic, there's always lots of patients that they can speak to with the same problem. And we just tell them, look, have a chat with this group of patients and see what you think. And then if you decided that you want to have stem cells to treat your problems, then sure, we can look into that for you.
I think that's fantastic, because oftentimes people are sort of nervous about asking doctors questions. And if they can ask people who are in the same sort of boat, they might feel more comfortable. What would be your advice to somebody who wants to try stem cell therapy, right? And they're looking for the right doctor. Now, I'm sure, as with any kind of thing in the world of medicine and healing, that you have, and you mentioned yourself, evidence-based, right? So how would you recommend someone who wants to try stem cell therapy as a treatment to choose the right doctor to go and see, and to find out whether or not their problem can be treated versus it's just someone going, yeah, I'll do it for you?
Yeah, I think, as I said, as I mentioned, evidence-based is important. Look at publications. We've published a lot, and it's not easy to publish in international peer-reviewed journals. And if your substance is not there, it will not be published at all. So that's one avenue that you can look at. And then nowadays, I think there are lots of information on the internet and everything, but you have to be careful, because look at the track record of the individuals that is providing this care. What are the results, and the important things that maybe speak to patients that they have treated. But again, literature is important. Search the literature, and nowadays in the internet you can search a lot and come up with a lot of information there. But do the right thing. I think that's the most important thing. And the worst thing to do is to have a surgery that does not solve the problem, and then it created more problems for the second surgeon to deal with the first problem that's not been sorted out properly. And that's the saddest part, that I see sometimes patients spend money having treatment and they're worse off, and then they suffer. It's not the right thing to do.
Absolutely. Great advice there. So thank you so much, Dr. Saw. This has been super interesting. I'm actually going to go and
very visual.
Google some things. Yes, very visual.